For decades, AIDS, tuberculosis, and malaria pose serious public health challenges in Nigeria. According to the latest national data, over 1.8 million Nigerians are currently living with HIV, with thousands of new infections recorded annually. The country also accounts for nearly 4% of the global tuberculosis burden, placing it among the world's high-burden countries. Malaria remains the leading cause of death among children under 5, with an estimated 68 million cases reported each year. In recent years, both federal and state governments, in collaboration with global health partners, have implemented aggressive response measures. These include free HIV testing and access to antiretroviral therapy, community-based TB screening, and the nationwide distribution of insecticide-treated mosquito nets. While these interventions have saved millions of lives, significant challenges remain in sustaining progress and reaching underserved populations.
Our task is very complex, but it demands also at the same time very candid discussions between us. I urge all of you to deploy yourself so that we come out with the roadmap, not only the what, but the how and the when for those questions, and relate those out in the objectives.
Minister, in his wisdom, set up this committee, this technical working group, to discuss what will be the immediate gaps, and also the intermediate and long-term sustainability plan to ensure that we are not solely dependent on external aid, but that rather Nigeria is sustainable, that we take ownership of the response in terms of tuberculosis, malaria, and HIV, and even other related illnesses and programs like maternal and child reproductive health.
With the recent suspension of some donor funding, health experts emphasize that the renewed push must adopt an integrated, self-reliance model. This includes strengthening diagnostic capacity, expanding treatment coverage, and addressing persistent gaps that continue to leave vulnerable populations at risk. Experts insist that sustained success will hinge on a coordinated and collaborative approach involving government agencies, development partners, and community-based organizations.
Nigeria has stood up. We're saying that we cannot rely on external funders to invest in the health and well-being of our own people. As we become a wealthier nation, we'll invest more of our resources to take care of our people.
Nigeria's goal is clear: to meet global elimination target for AIDS, tuberculosis, and malaria. In doing so, the country aims to write a new chapter in its public health history, one defined by resilience, innovation, and a commitment to safeguarding the health of every citizen. Evelyn Izebili reporting for BTV News.